So in this section of esophageal injury and infections, we'll be studying about drug-induced esophagitis. What are the different types of drugs and medicines that a patient takes and it causes esophagitis, it causes mucosal damage to the esophagus. In this section, we'll be studying about the mechanism, the clinical features, and the diagnosis. What are the different steps of mechanism through which the medicines cause injurious effect to the mucosal surface of the esophagus? And then what are the clinical features that a patient might present with while they take this sort of medication? And then how can we diagnose the drug-induced esophagitis? And then what are the different types of prevention and treatment? How can we prevent these drugs from causing esophagitis, and what are the treatment options? And then what are the specific medications which causes the drug-induced esophagitis? So if we talk about the mechanism, medication-induced esophagitis can be caused by different types of mechanisms. The first mechanism is that the facilitation of injury through another mechanism such as induction of acid reflux. This is not a direct injury to the esophagus. It is the injury is being facilitated with the help of acid reflux. The second type of mechanism is the direct injury to the esophageal mucosa because of different types of medications. In this, we'd be studying about the production of caustic acidic solution. In this, we can have the example such as ascorbic acid and ferrous sulfate. They cause a caustic acidic solution which causes injurious effect to the mucosa of the esophagus. The second is the production of the caustic alkaline solution. That was the acid solution, but this is the alkaline solution. In this, the example can be of alendronate, medicine which we are specifically use for osteoporosis. The third type of mechanism is the creation of hyperosmolar solution whenever there's a medicine in contact with the esophageal mucosa. In this, the example could be of potassium chloride. And then finally, the direct drug toxicity to the esophageal mucosa. This can be due to any of the aspirins that are being used, aspirin and any of the NSAIDs that are being used. The different types of risk factors that can cause injury to the esophageal mucosa. These include toxicity of the pill. The more the toxicity of the pill, the more it causes injurious effect to the esophageal mucosa. Particularly the contact time. If the medicine resides in your esophagus for a more longer period, it causes more injurious effect to the mucosa of the esophagus. Pills that are coated with gelatinous material are more prone to cause injury to the esophageal mucosa. Sustained release formulation, the formulations that are released with the help of the reaction with the mucosa. And then there's a drug called as wax matrix form of the drug. This sort of form of drug causes a very, very harmful effect to the mucosal surface and the muscularis of the esophagus. And then particularly if we talk about the patients with left atrial enlargement, patients with esophageal strictures, esophageal dysmotility, and esophageal diverticula. These patients are more prone to develop drug esophagitis due to the complications that have been occurred. So if we talk about the site of drug-induced injury, there are different areas within the esophagus which has a normal hypermotility and extrinsic compression. These areas are more prone to cause injury to the esophagus. There's a trough zone of esophagus where the smooth muscle and the skeletal muscles overlap. This is an area within the esophagus which are more prone. These areas are at the level of the aortic or at the level of the bronchial impression on the esophagus. These areas are more prone in which these medications can reside, and they can have a more contact period and cause injury to the mucosa of the esophagus. Now, if we talk about the different clinical features, what are the features that a patient might present in the outpatient department? The patient might present with odynophagia. Odynophagia is so severe that the patient might even present with odynophagia, which is pain with swallowing, with even a small amount of liquid which is being sipped. The second is chest pain. The chest pain is more particular toward the central chest, and it can also be radiated towards the back. And this chest pain is more specifically when the patient inspires, it's during inspiration. And the patient can also present with different types of heartburn within the epigastrium. Now, if we talk about the investigations, these all set of symptoms that are being produced with the fact that the patient takes the medication incorrectly. I'll discuss the different types of methods that a patient can take the medicines. So these set of symptoms with the patient taking the medicines in the incorrect method can cause the diagnosis to be confirmed. Other than that, endoscopy can also be used. Through endoscopic evaluation, you can see the different types of ulcers that are present within the esophageal mucosa and the different types of lesions that have been occurred within the esophageal mucosa because of the drug-induced esophagitis. And then the double contrast radiography. We can also diagnose drug-induced esophagitis with the help of an X-ray. We use a double contrast medium, and the double contrast medium is transferred into the esophagus, and an X-ray is being taken, and thus we can see the areas in the esophagus that has been injured. There's no specific treatment if you talk about drug-induced esophagitis, but we can help the patient with symptomatic control, which is with the help of local anesthetics. We can use lidocaine, and narcotics can also be used varyingly. And then we can prevent the injury from acid reflux. As I told before, that acid reflux can also cause sort of a mechanism that can cause esophagitis, drug-induced esophagitis. So in those patients, we can prescribe a proton pump inhibitor, which is given twice daily. And then adequate hydration. As the patient is suffering from odynophagia, painful swallowing, the patient can be given hydration through IV, and the removal of offending medications. The other method is that the medications that causes these type of esophagitis, we can ask the patient to stop using those medications and giving them an alternative medicine that can cause less injurious effect to the esophageal mucosa. So now I will discuss about the proper administration of potentially more injurious type of medications. What are the proper methods that a patient can use so that they can prevent the esophagitis which is caused by the medicines? Medications should be allowed with at least 8 ounces of liquid. A patient, when taking medicine, should be having a glass of water with them, and they should take at least 8 ounces of liquid or water while taking the medicine. The patient should be in an upright position for at least 30 minutes following ingestion. Patients usually come up with drug-induced esophagitis, and they confess that after ingesting the medication, they might go to sleep, or they might lay down. So that is one of the main causes of esophagitis to occur. So a patient should be in an upright position, sitting down or standing for at least 30 minutes after taking the medicine. And with increased risk of injury, the patient might have to take the medicines that are absolutely necessary. The medicines that are not necessary, they might have to omit those medications and take those medications that are very necessary. For example, for different types of diseases such as cardiovascular disease or pulmonary disease or renal disease, the medicines that are very absolutely necessary. So if we talk about different medications that are involved in drug-induced esophagitis, firstly, there are the antibiotics. antibiotics including clindamycin, doxycycline, penicillin, rifampicin, tetracycline. So these antibiotics are the most common causing medications that causes drug-induced esophagitis. If you see through an endoscope, the ulcers that are caused by antibiotics are usually very small and superficial, and they have a burn. They have a burn-like appearance. The second, antiviral agents that are more prone into having an injurious effect to the esophagitis are nifenavir, zalcitabine, and zidovudine. These medicines are more prone to causing a drug-induced esophagitis. If we talk about the bisphosphonates, this particular group is a very rapidly emerging category that causes drug-induced esophagitis. These include alendronate, etidronate, and pamidronate. Other than that, risedronate is also being used, but bisphosphonate has a very low potential of causing an esophagitis. And other than that, if we see through an endoscope, the ulcers that are being produced with bisphosphonates have a very inflammatory sort of appearance. They have an inflammatory exudate and granulation tissue that occurs within the esophagus, within the site of injury. Other than that, the complications that are involved with using bisphosphonates are strictures and hemorrhages. The different type of chemotherapeutic agents such as bleomycin, cytarabine, and dactinomycin. These chemotherapeutic agents are usually used in patients with hematopoietic stem cell transplantation. These also have a very injurious effect on the esophagus. Other than that, there are different types of NSAIDs, such as aspirin, ibuprofen, naproxen. These medications, they cause very injurious effect to the esophagus, and especially because they're the over-counter medications that the patient can plainly go to the pharmacy and get these medications very easily. And because of the continuous use of these medications, they can cause drug-induced esophagitis. The very common complications that are caused with NSAIDs are hemorrhage. Hemorrhage is very common complication with NSAIDs. Other than that, other medications such as ascorbic acid, ferrous sulfate, lansoprazole, multivitamins, potassium chloride, quinidine. Potassium chloride has a very different sort of effect that on the esophagus. It causes stricture and it causes perforation. The perforation is so deep that it could even involve the left atrium, and it could also involve the bronchial artery. And there's a very specific complication which is called as the atrioesophageal fistula. In atrioesophageal fistula, the patient might present with fever and neurological abnormalities. The neurological abnormalities is due to the reason that there's an air emboli that passes from the esophagus into the left atrium, and this emboli then travels into the brain, which causes neurological abnormalities in the patient. It is a very fatal complication. In the diagnosis, we can see that the left atrium is covered with air bubbles and gas molecules, and the treatment of the atrioesophageal fistula is surgery. There's no other treatment other than that. So in this section, we have studied about different types of drugs that causes esophagitis. We've seen the mechanism. There are two types of mechanism. There's the direct injury to the esophagus, and then there's a mechanical facilitation with the help of acid reflux that can cause injury to the esophagus. Other than that, we've seen about different types of risk factors and different types of patients that are more prone to having a drug-induced esophagitis. And then we've seen different types of in treatment options the different types of treatment options and the methods that a patient should be taking to prevent the drug-induced esophagitis, the methods of taking the medicines correctly. Other than that, we've seen different types of medications such as NSAIDs, bisphosphonates, and chemotherapeutic agents, and different types of other medications that can cause drug-induced esophagitis. That's all from this section. Keep watching sqadia.com.